Williford.
My name is Nick Walker.
And I'm Adriana Ballard.
Now, a study from the Health Resources and Services Administration says that 60% of Americans are organ donors. Though this accounts for over 160 million people, only 3 in 1,000 people become organ donors. Now, 100,000 people are waiting for an organ, while only 40,000 people per year, only 40,000 people receive an organ donor per year. Now, this graph shows from the Harvard Advanced Leadership Initiative that even though the number of transplants received and donors are increasing over the years, you can see how much more significant the increase of people on the waiting list is increasing. Now, we chose candidate D because 1, he has a wife and 3 kids, which shows he has someone to go back to after the surgery. He is also in relatively good health, and he doesn't drink or smoke, which shows that he'll live a long life after the surgery. And he works at a major advertising company, which shows he can still contribute to society after the surgery, and that he has health insurance to cover the cost of the surgery.
The first major predictor of longevity and quality of life after a successful heart transplant is how strong your familial support is. According to Dr. Mary Dew from the Journal of Heart and Lung Transplantation, stronger support from the primary family support person is associated with better ability to stick to and handle a medical plan, lower risk of substance use relapse, lower risk of graft failure, longer survival, lower risk of mental health problems, and increased satisfaction and quality of life. Also, according to Dr. Lawton from Tufts University School of Medicine, patients reporting higher social support experience statistically significantly higher odds of superior post-transplant outcomes. Here we can see that family ties are strengthened almost always after a heart transplant, which is important because before a heart transplant, having the strong family foundation is important because it will likely only grow after a heart transplant, leading to these benefits that you get with strong family support.
The second factor we took into consideration was the impact of any prior diseases. Specifically at candidate D, he is in relatively good health and has no indication of any prior infections or diseases. This is concluded due to the fact he has no history of substance abuse or any drugs or alcohol. Indications of any prior infections can impact the survivability and longevity after the heart transplant, which can be super impactful on the patient's lives. According to the Journal of Heart and Lung Transplantation, infection was the highest cause of death in the short term right after the heart transplant. And specifically, this was most common in patients who had any prior diseases or malignancies in them. Looking at this first graph, we can these are the conditions of every patient who had any prior malignancies or diseases. 12.3% of them have died only in the short term. While this might not seem as big as a deal, if you look at the cause of deaths, more than half of them died to infection or a recurrent cancer or the malignancy coming back up and taking over their bodies.
One major factor to look into is financial stability and to see how financially stable your patient is. Financial stability plays a crucial role in the decision of receiving a heart transplant. If a patient is not financially stable, nor has a steady income, how will they provide for the numerous costs that goes into receiving a heart transplant? These costs include hospital bills, medication, follow-up care, and much more. Nobody wants to experience financial burden now or later throughout life, which is why it's important to ensure you have a steady income and a steady financial situation. Also, insurance plays a huge factor with your stability for your heart transplant surgery. Insurance makes sure that the patient has proper care and proper resources to undergo heart transplant surgery and your recovery experience. This graph shows the orange represents the people who are uninsured, which has a higher percentage of people who are more stressed and worried about their medical bills and financial situation. While the blue represents the people who are insured, which shows a lower percentage of people who are less stressed and less worried about their financial situation. This shows how people who are insured have less of a financial burden and have less worries about their financial status.
It's important to note that hypothetically, these are human lives being weighed against each other, and in doing so, there should be no bias present. According to a policy report on organ allocation by the Canadian Medical Association, there should be no discrimination based on social status or perceived social worth, and lifestyle or behavioral factors should only be considered when they will impact the medical probability of success. That being said, all of the candidates listed fail to meet the criteria previously described. None of the candidates have as adequate familial support as candidate D. The candidates listed have past medical history or past habits that could impact their quality of life after the transplant, and there's no concrete mention of any of the candidates having insurance. So who else was on the waiting list? First, there was candidate A, a recovering alcoholic. Although she does have 14 months of sobriety, there is the risk of her past alcoholism causing complications after the surgery. Recently widowed, her only remaining family includes her 6-year-old daughter and her grandmother. Her daughter is quite young and her grandmother elderly, meaning that it's not known for sure if she will receive the care she needs post-operatively. There's also no mention of whether or not the company that employs her will cover the cost of the surgery. Candidate B is an ex-smoker and suffers from high blood pressure, meaning he fails to meet the requirement of having good health prior to needing the transplant. He has distant adult children and is currently caring for his wife in a nursing home, meaning it's unlikely there will be anyone to provide him with the care he needs. There's also no mention of him having insurance, and we can assume that he will already be burdened by his wife's medical costs. Candidate C exhibits habits that could negatively impact quality of life after the surgery, has no time for family, and also has no mention of insurance. And candidate E, unfortunately, is in no place to receive the transplant, as she has no family to speak of, is unhoused, and she's not financially stable. Thank you.